Another congested morning leaves Maya asking a familiar question. Is this allergies acting up, or the start of a sinus problem? At the kitchen table, Maya pushes through her routine, but the congestion, watery eyes, and constant tissues make even a normal morning feel harder. Congestion, coughing, a runny nose, and irritated eyes can overlap, which is why allergies and sinus trouble often look similar at first. At work, Maya hesitates. Is she coming down with something, or reacting to the air, dust, or pollen around her? The challenge is that everyday exposures and actual infections can both leave you congested, uncomfortable, and unsure what your body is reacting to. To sort it out, doctors look for simple clues: what the symptoms feel like, where they show up, and when they happen. One major clue is location. Symptoms around the eyes can suggest allergies, while deeper pressure inside the face can point toward the sinuses. When symptoms flare after time outdoors or near an open window, that timing can be an early clue that allergies are involved. Itchy, watery eyes, repeated sneezing, and a thin, clear, runny nose together form one of the most classic allergy patterns. If the same symptoms return during the same weeks year after year, seasonal allergies move much higher on the list. Allergies are not only seasonal. Dust mites in bedding, carpeting, and pillows can trigger year-round symptoms inside otherwise tidy spaces. Pets can complicate the picture too. Maya enjoys the moment, then notices symptoms that could easily be mistaken for a lingering cold. Put together, itching, sneezing, watery eyes, and thin, clear drainage strongly support allergies as the more likely explanation. Sinus infections tend to feel different. Instead of itching, the bigger clues are facial pain, pressure, and a heavier sense of blockage. That pressure happens because the sinus cavities around the nose, eyes, and forehead can become swollen, blocked, and painfully congested. Thick yellow or green mucus is a stronger clue that sinus inflammation and sometimes infection may be part of the problem rather than allergies alone. When Maya feels feverish, drained, and generally sick on top of congestion, that whole body slump can point away from allergies and more toward a sinus infection. Duration matters too. Allergies may flare with exposure, but symptoms that last longer, worsen, or refuse to clear can suggest a sinus infection. Dr. Brooks compares patterns side by side. Allergies usually bring itching and clear drainage, while sinus infections more often bring pressure, thicker mucus, and feeling sick. Think in contrasts: clear discharge versus thick mucus, itchy eyes versus facial pain, and predictable seasons versus a less predictable start. Outdoor allergies often follow the calendar. Tree pollen, grass, and seasonal blooms can trigger congestion, sneezing, and itchy eyes at fairly predictable times. Indoor allergens can be harder to notice. Dust mites thrive in bedding, upholstery, and carpets, even in homes that look spotless. Pets can also be part of the picture. It is often the dander, not the animal itself, that keeps allergy symptoms going indoors. Pollution and irritants add another layer. They can aggravate allergy symptoms and also make sinus discomfort feel worse, even when they are not the root cause. Sinus infections are more often linked to a recent cold or viral illness than to the seasons, especially when congestion lingers after getting sick. Less commonly, bacteria and occasionally fungi can play a role. But for most people, the useful question is whether symptoms fit an infection pattern. Instead of guessing, Maya starts tracking patterns: when symptoms happen, what they feel like, and whether they follow seasons, exposure, or illness. A quick shortcut can help. Is it seasonal? Are your eyes itchy? Is the drainage clear or thick? If facial pain, fever, and longer-lasting symptoms enter the picture, the balance shifts more toward a sinus infection than straightforward allergies. As Dr. Brooks reminds us, one symptom rarely settles it, but when the clues line up, the pattern usually becomes much clearer. Knowing the likely cause helps you choose smarter self-care, whether that means allergy relief, gentle sinus support, or recognizing when symptoms may need medical attention. Instead of guessing, Maya starts tracking when symptoms began, what they feel like, and what was happening around her. That simple record turns uncertainty into useful clues. More significant facial pain, fever, or symptoms that last beyond several days deserve closer attention, especially if pressure and thick drainage seem to be getting worse instead of better. Frequent sneezing, itchy eyes, and flare-ups tied to certain seasons or exposures usually point more toward allergies, especially when the drainage stays thin and clear. A simple real-world check can help. Notice whether being outdoors, around plants, dust, or pets changes how you feel within a familiar pattern. If the pattern still is not clear, a medical visit can help connect the details and point you toward the most appropriate next step. Diagnosis is often a collaborative process based on timing, symptom quality, duration, and related signs like itching, pressure, fever, or thick mucus. In short, allergies usually bring itching, sneezing, watery eyes, and clear drainage, while sinus infection leans more toward pain, fever, thick mucus, and longer-lasting symptoms. With a clearer pattern in mind, Maya feels more in control. The symptoms are still real, but now they seem easier to understand and manage. Paying attention to the details your body gives you can make the difference between guessing and making a more informed call about what may be going on. The right clues can guide the right next step, whether that means watching for triggers, using supportive care, or checking in with a clinician. Have you noticed a pattern in your own symptoms? Share your experience in the comments and subscribe for more clear, practical health guidance.